this again. So welcome everybody. This is Helene Burns. I am the chief nurse for Jefferson, New Jersey. I am absolutely thrilled to be here today for this unveiling. And I am here to introduce our Executive Vice President and Chief Nursing Executive, Susan Campbell.
Join the meeting.
Everybody. So it is a pleasure to be here. A little thing
Join the meeting.
Revealing the professional practice model called COVID. We had all these amazing plans to do this in January.
Join the meeting.
I know it may seem a little late to you, and I know that you all have been extremely busy taking care of our patients in our communities. And I just want to take this opportunity again to thank you. I've been a nurse now for 46 years, and I have never seen anything like this. I know all of you have not either. It's unprecedented, the pandemic and what happened. But what also is unprecedented for me is how every single person brought their best every day for their coworkers and for their patients and for their communities. And that despite the challenges, despite the acuity of the patients, and despite your own personal feelings and your own personal fears, you made it happen for our community. It is an amazing thing to see and to watch all of you. I had never been prouder to be a nurse than to watch all of you work and do what you do.
Join the meeting.
That is just give terrific, awesome, extraordinary care under extraordinary circumstances. It's a very different feel today. I know out there at the height, we had 800 patients every day, COVID patients throughout. We now have 60, but still COVID is with us, and still you all are making sure that we take care of our communities just like we did at the height of the pandemic. I want to take this opportunity when I'm in front of you to say that we are here for you, because I know that
Join the meeting.
Comes with a toll. It comes with a personal toll, and I just want to encourage each of you to reach out and get any resources that you might need. I am worried about you. I'm worried about your mental health and your perseverance and your resilience, and we want to make sure we take care of you just like you took care of everybody else. So please reach out to your manager, your leader, to your CNO, and we have a lot of resources to help. And I give that message wherever I'm at. And I know this has nothing to do with the professional practice model, but I just wanted to take that opportunity. So we are going to talk about the professional practice model, and I don't know how many of you that are online or in the room were part of the retreat that we had last summer in July, that we had around 250 staff nurses and leaders combination come together to really define what the Jefferson nurse stood for. What is it that we're going to stand for, and what is our professional practice model? And this is the work that came out of that. That at that same time, we asked you to be creative. We asked you to put together what pictorial of what those would look like, and you did. It was amazing, the artists. Everybody was kind of wondering how we were going to be able to do that, but we actually had, I think, around 40 different pictures of what the professional practice model would look like, and we were able to vote and get it down to 2 at that time. So we had the 2 top images, which were a key, and then what were the Declaration of Independence, our take on Jefferson's Declaration of Independence. What we did then is we took a group of nurses, including leaders and staff again, to kind of basically take those images and make sure they were the best representation that we thought they could be. And we worked also with marketing to have a graphic artist help us with that. And then we put it out to vote. And I was really impressed with the number of nurses that participated. The reason we're here today at New Jersey, and we have the shared governance leaders and different leaders from the team, we have New Jersey here today because over 1,000 New Jersey nurses voted. So yay, New Jersey. So, I am so excited to be able to do this. I really think that you're going to be pleased with the representation that we have. And it is our unveiling of the Jefferson Nurse Professional Practice Model. So Kim, if you could help me.
Join the meeting.
I feel like we need to
Join the meeting.
Okay, so now we have the key. It's a golden key, as you can see. We did vote on this again, and we had an internal vote. We think this really is an amazing representation of the professional practice model. And we think the key is an amazing thing. It's an everyday object that each of us uses every day to get into the place that we want to get into. And we think that's what the professional practice model really is about. It's how to get entry into those locked areas. Just as nurses provide insight into patient care, the key represents the insight that we get. It represents multiple parts to be effective in its purpose. The head of the key represents the collaborative relationships that are fostered at Jefferson between the professional nurse and the patient and family. And this relationship promotes an environment of trust and respect where each person contributes and is an active member in the plan of care. And we always know that the patient is in the center. The patient is in the center of everything that we do. The rings that make up the head, they reflect the attributes of the Jefferson nurse. And we voted on those attributes once again and came up with them at our retreat that we had last year. And those attributes are expertise, integrity, innovation, compassion, confidence, connection, empathy, dignity, kindness, partnership, inspiration, and advocacy. And I think what I saw over the past 5 months, you all excel at each and every one of these. The shoulder of the key signifies the high priority of safety within the nursing practice. This is the stabilizing force ensuring that we do not harm. And that is one of our initial promises to the patients and the families that we take care of, that we will do no harm. The blade of the key represents our care delivery model that we also chose during that day. And we chose our nursing theorist, Joanne Duffy, and it's the quality caring model. And you can see that that is the blade of it. And what that means is it focuses on relationships, professional development, and self-care as a means to promote quality. The cut of the key represents that we are one Jefferson nurse. We are one nursing enterprise, and that we're going to deliver on that promise that wherever a patient or family touches Jefferson, they get the same standard of nursing care. And now we move forward. We know that nursing is the key to that. On September 22nd, Joanne Duffy will be the keynote speaker at the Jefferson Research Conference, and it will be on Zoom. I encourage all of you to attend and learn about the quality caring model, which is the foundation of the PPM. Marketing is going to incorporate our PPM into the Jefferson Nurse Branding Campaign. You know, we do have the best nurses in the nation. You all excel so much. You are the key, and our professional practice model, I think, reflects everything that you are. And I just ask each of you to join the journey to excellence as we continue to improve our outcomes and our work environment. I want to thank all of you today for being here. So impressed with the work that we've done and that you're going to continue to do. And just from the bottom of my heart, I really care about each and every one of you. Thank you so much. So that's the end of our short ceremony. Now each of you get to go back to what you do best, is taking care of patients.